My name is Andrew Schneider. I am a DDS, Doctor of Dental Surgery. Got my training at UT Memphis, class of 1999, and I am the managing doctor at this location, Springfield. I have been practicing dentistry 26 years. I've been placing implants 15 years of that. I cannot tell you the number of implants. I'm sure it's been thousands, and arches pretty close to that too. I've probably done about 1,000 arches at this stage. All in four patients, like all patients that we see with dentures or overdentures, they're kind of crippled dentally. They're missing teeth. There's a lot of decay. They're in pain. They want to be back to where they were when they were younger, when their teeth didn't bother them, and that, which we can achieve very well with fixed, and they have something they can depend on for the rest of their lives. Most people, when they come in, they're embarrassed. They're embarrassed about their smile. They take it as a personal embarrassment that something they did. We need to get them in and take care of them, give them their smile back, give them their ability to chew. They'll be healthier, happier individuals if we can do that for them. On all-in-4 surgery day, basically it's a matter of getting the patient comfortable, giving their medications, getting them numb. It's not too bad after that. Once we do, it's a matter of getting teeth out, place the implants. What usually takes the longest is getting their new teeth ready. We have to pick them up and make sure they fit right and adjust them, and that does take a little bit of time. So it's several hours they'll be with us just to get the teeth right. When we do our fixed or our all-in-4 arches, I'm a little different. I know some people will place the implants and then design the teeth around it. I go the other way. I have digital technology. We do facial scan, intraoral scans, and we design everything three-dimensionally. That way they can verify that's what they're wanting before we get started. Smile definitely is the first thing you can notice with these patients, but they seem to have more energy. They are more energetic. I think it's because they can eat better. They're eating a more proper diet. Their bodies are reacting to that. They become a whole individual again. If somebody thinks they're too old, do you not deserve the best? As we get older, we still need to eat. We still need to smile. We all deserve the best, no matter our age. Concerned with the cost, once again, are we not worth the best? Why would we want to spend the end of our life not functioning as well as we could? If we were going to use it like a leg, it's a pirate leg. It's a peg leg. It will give you function, but it's not the best choice. All-in-4 would be the bionic leg. And yes, they make bionic legs, and it would give you the most function, the best prosthetic that we have available to us. I do no less for one of my patients than I do for myself. If you're suffering with your teeth, all I can say is, why put it off? It's not going to get better with time. It gets worse. If you want something like fixed, don't waste time. Come in and see me. See what I can do. We want to help you.